an unprecedented global health emergency that swept across the planet. After more than 3 years, 6 million deaths and over 600 million infections on record, the end of the pandemic is now in sight. At least that's what the World Health Organization feels. Earlier this week, the WHO chief said we have never been in a better position to end the pandemic.
Last week, the number of weekly reported deaths from COVID-19 was the lowest since March 2020. We have never been in a better position to end the pandemic. We're not there yet, but the end is in sight.
Despite getting this encouraging news after so long, some questions still remain. First, is the end of the pandemic really in sight? We ask this because governments all over the world have declared a victory over the pandemic. Every now and then, ever since the pandemic started. But letting the guards down too soon only led to a comeback of COVID. Many countries saw a deadly comeback of infections, tighter restrictions and more economic losses. Second, the virus itself keeps mutating. Just recall the number of variants you have heard so far: Alpha, Beta, Gamma, Delta, Omicron, and the list goes on. Some of these were more deadly while others spread faster. For instance, Omicron infections generally cause less serious illness, and we have seen fewer deaths with Omicron than with earlier variants. But the Delta variant was 60% more transmissible than Alpha, that originated in United Kingdom around September of 2020. The Alpha variant itself was 50% more transmissible than earlier variants. With today's vaccines, we are definitely better prepared for new variants. But having vaccines doesn't in itself guarantee that the virus will stop mutating. The next question surrounds global vaccine equity. Ever since the first vaccine appeared, we have repeatedly voiced our concerns around vaccine equity. While most Western countries have announced booster doses and double booster doses, in Africa, vaccination continues to be slow. According to July 2022 reports, only 21% of the population had been given double doses. This means only 1 in 5 Africans had been vaccinated. Finally, the danger of the virus coming back isn't really over. A recent report by Lancet says that the war in Ukraine and climate and economic instability have taken focus away from the pandemic. A total of 28 experts from across the world say that surveillance and testing capacity must be safeguarded. This will help prepare for a possible winter surge in the Northern Hemisphere. The report in its stinging remark says that global figures and failures at multiple levels in the COVID-19 response led to millions of preventable deaths. The report also called for collective action. This will help promote public health and sustainable development to bring an end to the pandemic. And for more on this, we were earlier joined by Amish Adalja, who is an infectious disease specialist and senior scholar at the Johns Hopkins Center for Health Security.
I do think that we are in a much different place with COVID-19 than we have been in earlier eras of the pandemic, and this is worldwide. And that's despite the fact that there have been issues with getting vaccine into the arms of some of the developing countries. And that's because there's so much immunity in the population because the virus has infected so many people, and then there are individuals who've been vaccinated. So what we will see is, yes, COVID-19 is always going to be a problem. It is going to be a respiratory virus that's never eliminated, that's never eradicated. But it's increasingly not going to be something that is able to overwhelm hospitals. And I think that's where we always wanted to be with this virus, because as I said, it's something that's always going to be with us. The goal was to make it more of an outpatient illness. And I think with vaccines, with boosters, with monoclonal antibodies, with antivirals, with home tests, as well as with all the immunity in the population, even with new variants that are inevitably going to occur, they're going to be less likely to be able to cause severe disease that's on the scale that it once could. This is one of the biggest unanswered questions we have about this virus. We still are really scratching the surface when it comes to long COVID, and there are many, many more questions than there are answers. We still have to agree on a basic definition. We have to understand what the risk factors are, what the actual symptoms would be, and we have to distinguish those from people who were in the hospital for a prolonged period of time and maybe have post-ICU syndrome or post-hospital syndrome. So there's a lot of work that needs to be done. But I think this is going to be one of the most pressing research challenges in the years to come, and hopefully we'll have some answer. But the biggest thing that we do know about long COVID is that if you're vaccinated, you are much less likely to get long COVID.